Welcome to The Explainer. I'm thrilled to have you here today because we're exploring a truly fascinating, multi-billion-dollar phenomenon that's completely reshaping how we think about human health. We're talking about the borderless healthcare boom, better known as global medical tourism. Just imagine packing your bags, grabbing your passport, and flying across the globe, but not for a vacation. You're going for a life-changing surgery or some cutting-edge medical care. It's happening right now, on a massive scale, and honestly, the mechanics behind it are absolutely captivating. To really wrap our heads around the sheer scale of this industry, we first have to ground it in the real, human experience of cross-border healthcare. Picture this scenario. A patient travels all the way from Northeast India to Mumbai for their mother's treatment. While sitting in that hospital waiting room, they're suddenly surrounded by patients who traveled from Bangladesh and folks who flew in all the way from various African countries. It's a true melting pot of nationalities, all converging in one single location with a shared universal goal: the pursuit of healing and world-class care. Okay, let's dive into our roadmap for today's explainer. First, the borderless healthcare boom. Second, why patients travel abroad. Third, the global medical map. Fourth, risks versus rewards. And finally, number 5, the future of care.
Part 1. The borderless healthcare boom.
So, what exactly are we talking about here? Let's get a clear definition. Medical tourism is the practice of traveling to another country to receive medical, surgical, dental, cosmetic, fertility, or even wellness treatments. Now, historically, this might have been kind of a niche market, right? Maybe a few wealthy individuals traveling for exclusive treatments, but actually, scratch that. That is no longer the case. Today, this has evolved into a major global sector. We're talking millions of everyday patients crossing international borders every single year for everything from routine dental implants to highly complex organ transplants and cancer treatments. Now, what's really going to blow your mind is the sheer volume of money we're talking about. $174 billion. That's the upper estimate for the projected global market size by the year 2035. That number is just staggering. It really proves that we're looking at an absolute economic powerhouse of an industry here. To put that into perspective, industry estimates for the global market size in 2025 sit somewhere between $34 and $76 billion. But then look at the leap to 2035, jumping all the way between $126 and $174 billion, or maybe even higher. This represents an expected annual growth rate of 8 to 14%. And a massive piece of this pie belongs to the Asia-Pacific region, which remains one of the fastest-growing areas on the planet for this. Why? Well, it's a powerful combination of affordable healthcare, internationally accredited hospitals, and some really strong government support. Part 2. Why patients travel abroad. So, the crucial point really boils down to this contrast. On one hand, we have domestic healthcare in many developed nations. You've got skyrocketing costs, overloaded systems, and patients who are forced to wait literally months just for elective surgery. On the other hand, we have the medical tourism alternative. Patients are seeing incredible cost savings, often between 30 to 80%, and yes, that's even after factoring in the flights and the hotels. Plus, they gain access to immediate consultations and can usually have their surgery scheduled within days. Patients are essentially bypassing the long wait times of their home countries while keeping massive amounts of money in their pockets. It's a real game changer. But I really want to stress this point. It is not just about finding the cheapest procedure. The drivers of growth tell a much broader story here. Patients are actively seeking out high quality. A lot of these international hospitals boast international accreditation, advanced digital systems, and specialists who actually trained in the US, the UK, Germany, or Japan. On top of that, patients travel for highly specialized treatments, things like robotic surgery, complex IVF, or stem cell therapies where they're legally available. And finally, there's a massive wellness component. Modern medical tourism beautifully combines clinical care with holistic healing. We're talking spa rehabilitation, ancient Ayurveda, and luxurious beach recovery resorts. It's the whole shebang. Part 3. The global medical map. All right, let's take a rapid world tour of the major destinations. Ranked highly, we have Thailand, which is incredibly famous for cosmetic surgery, orthopedics, and it's a highly established center for gender-affirming care. Then we have India, growing exceptionally fast thanks to its medical visa program, offering top-tier cardiac surgery, oncology, and Ayurveda. Turkey leverages its modern hospitals and its proximity to Europe to basically dominate hair transplantation and bariatric surgery. Singapore is the go-to destination for high safety standards and highly complex precision medicine, like advanced cancer care and neurology. And rounding out our top 5 is South Korea, internationally recognized for advanced aesthetic procedures, dermatology, and robotic surgery.
Continuing our tour into the top 10, Malaysia offers a multilingual workforce excelling in fertility and cardiology. Mexico strategically leverages its incredibly short travel distance for U.S. and Canadian patients, becoming a hub mainly for dental care and bariatric surgery. The United Arab Emirates, particularly Dubai, is aggressively developing premium luxury healthcare experiences. Costa Rica beautifully marries dental implants with nature-based wellness recovery. And finally, Germany attracts patients globally who are seeking cutting-edge clinical expertise, advanced diagnostics, and complex neurosurgery.
Part 4. Risks versus rewards. Now, like any massive global industry, this is a serious balancing act that every single medical tourist has to evaluate objectively. On one side of the scale, the rewards are undeniable. We've discussed the significant cost savings, the drastically faster treatment times, access to world-class specialists, and for procedures like cosmetic surgery, a much better level of privacy away from home. However, on the flip side, there are serious risks to consider. Patients face potential travel-related complications, language barriers, and the difficult reality of limited follow-up care once they fly back home. Furthermore, variable healthcare standards, legal differences, and infection risks mean that things can and sometimes do go wrong. This is exactly why experts strongly advise patients to rigorously verify internationally accredited hospitals and to absolutely always consult their local physicians before deciding to pack their bags. Part 5. The future of care. So, let's zoom back out for a second to look at the technological horizon of this entire global healthcare ecosystem. What's next for medical tourism? Well, the future is heavily digital. We're looking at a world of AI-assisted diagnostics and smart hospitals that streamline literally every aspect of patient care. Crucially, pre- and post-treatment telemedicine is poised to completely erase the traditional hurdles of cross-border care. I mean, imagine having a virtual post-op consultation with your surgeon in India while you're sitting on your living room couch in London. It seamlessly bridges that gap of follow-up care. Add in personalized genomic testing, digital patient records, and expanding international insurance partnerships, and the entire experience is becoming vastly more integrated and, quite frankly, a lot safer. Which leaves us with a pretty provocative thought to chew on. As borders continue to dissolve through digital healthcare, artificial intelligence, and personalized medicine, will the term medical tourism eventually just disappear entirely? As these global connections become the absolute norm, we might soon stop thinking of it as a special medical trip abroad and realize it has simply become the new standard of global healthcare. It completely changes how we view access to quality care for everyone, everywhere. Thank you so much for joining me on this incredible journey across the global medical map. If you liked our explainer today, please do drop a comment below. We absolutely love hearing your thoughts, your experiences, and what topics you'd like to see us break down next. Keep learning, stay curious, and I'll catch you in the next explainer.